okay?
Yes.
So what we're doing, we've already done a consultation with the beautiful Sally and worked out a few things that we're going to do. So raise your eyebrows up, Sally. We're going to treat the forehead lines, but in a way that we actually create a little bit of a lift in the lateral part of the brow. Frown in there. We're going to get rid of this frown, which will, and relax. That will actually lift that up and flatten that out. You won't be able to make that frown, but you will be able to raise your eyebrows. We're also going to, Sally's got a little bit of an overactive jaw or chin really, and that's just lifting up and flattening the chin there. So roll your bottom lip out for me. So we're going to put a little bit of Botox in there. And we've also got a little muscle here that's pulling the corners of the mouth down. Chin's going up and the corners are coming down. So this is very much something that we can prevent. It's not age related, it's just genetic. It's what you've been handed down, usually from your mum. And very much worthwhile treating and fixing that before it actually occurs, because Sally's got beautiful lips. The last thing we want to do is have them look like that, and that's what they'll look like over time. Now the other thing that we noticed looking at Sally's face is that her jawline is very, very strong. She's got a very, very strong cheek muscle here, the masseter muscle, and this is involved in jaw clenching. So when we see it quite prominent like this, it usually indicates that this person clenches their jaw or grinds their teeth at night. And Sally, do you grind your teeth at night?
Yes, I do.
And do you get pain in your jaw?
I do.
Yeah, okay. So it usually goes hand in hand. So when we treat this, it's really a win-win situation. We treat it because we can actually slim that jawline right down and make it a much more glamorous, feminine shape of a face, but it also stops that jaw grinding, which is really, really important. So clench for me. So some dentists, where they get people to have soft diet, Valium, and wearing a mouth guard, which to me, I mean, I had that problem too, and it was really unsatisfactory having it treated that way. But putting a little bit of Botox into here, it's just fantastic. It just relieves that pain enormously. And the good thing about that is that treatment usually lasts about 8 to 9 months too. But overall, what we're going to do is a little bit of Botox here, a little bit of Botox down here, and also in the jaw. And then what we're going to see over time is we're going to actually get this much softer jawline here with no pain. And then what we might do, if Sally's feeling like doing so in a little bit of time, maybe a month or so down the track, is putting a little bit of filler here and just redefining that cheekbone and just giving a little bit more curve and structure to that cheekbone, which will really look just beautiful. Now Sally also has headaches fairly regularly, and they're quite typical of a migraine in that she feels them in the temples and also in the back of the neck. So we're actually going to also put a little bit of Botox just into the 2 little points here and a little bit into the temples, and in addition to treating that frown or the forehead and that frown there, that should give her complete relief of headaches for about 3 to 4 months.
Sounds good.
Okay, we'll draw it all up. That's right. Stop that now.